All right, welcome everyone. Very excited to be kicking off our Impacting Policy series for the fall. Today, I'm Beth Griffiths and my colleague Janet Kaufman will be joining us as well. And we are the co-associate directors of policy programs for IHPS. We're really excited to be again sharing our 101 talk, which kicked off the very beginning of our series, but we got lots of requests to do it again as we have many new folks who have joined UCSF and then many people who were not aware of our series when we first kicked it off. And so we will do this just in the same way with maybe some slight updates from our first talk. As always, please feel free to put questions into the Q&A. And yes, the recording will be available on the IHPS website. All right. So just an outline for today. We're going to begin by talking a little bit about the series and where we'll be this fall and beyond, a little bit about our roles, and then we'll head into mapping the policy landscape, the legislative process, and then Janet will talk about the administrative and judicial processes and the budget process. We'll talk about each of our own Q&A or case studies and kind of the work that we've done, and then of course we'll take questions. If we see questions during the talk that seem really relevant in the moment, we may try to break in with them. So feel free to put questions in the Q&A as they occur to you. So our learning objectives for today are to describe how to map the policymaker and stakeholder landscape around whatever issue you're working on, and then how to assess how the legislative process and the calendar should influence the timing of your actions. This is so important. I think oftentimes I see people do things that might have been successful at a different time, but just don't land based on where they're at in the legislative process. And then we'll talk about tracking your legislative or budget issue of interest to see, once you have a bill number, what's actually going on, where is it at in the process. And then our goal is that by the end, you'll be able to compare and contrast how to impact the legislative, administrative, and judicial processes. So as introductions, I'm Beth Griffiths. I'm a primary care doctor here at UCSF. I spend about a third of my time doing that. I also spend a third of my time teaching a variety of different learners in the space of policy, advocacy, and community engagement. And then I have the great good fortune to share a role with Janet of Associate Directors of Policy Programs at the Institute for Health Policy Studies. And our overarching goals are to train UCSF faculty, staff, and trainees in really how to effectively engage with the policy process and connect UCSF faculty, staff, and trainees with policymakers, and then, of course, collaborate with other groups. In that vein, we're really thrilled this year to be collaborating with Impact, which is a portion of CTSI that really also shares our mission of helping to train UCSF faculty, staff, and trainees to know how to effectively engage with the policy process and then to actually help connect them to do so. And so we're grateful to both groups. As far as the series for this fall, today, here we're on Zoom, Impacting Policy 101, back by popular demand. And then on October 11th from 12 to 1 on Zoom, we will be joined by Mara Decker, Kim Rhodes, and several community partners with whom they collaborate to talk about collaborating with community-based advocacy organizations and coalitions for policy change. On November 8th from 12 to 1, also on Zoom, we'll talk about impacting policy internationally. And Jenny Liu will be joining us to discuss that topic. And then in addition, we're going to have this fall a half-day in-person workshop. This will be our second, and we'll do another one in the spring. That will be October 24th from 2 to 5 p.m. On how to brief policymakers. And that will be much more hands-on, small groups. You'll walk away really feeling like you're prepared to actually go and brief policymakers. And then, of course, more to come in the spring. And we are always welcome to suggestions or ideas. Feel free to reach out to either of us. So before I dive in more, I'll let Janet introduce herself.
Yes, thank you very much, Beth, and apologies, everyone. The parking gods at Parnassus were not particularly kind, but I made it. I'm here. So I'm Janet Kaufman. I'm Beth's co-associate director of IHPS for policy programs. Let's see, I have PhD in health services research. My own work is primarily in health workforce and health insurance. I'm just really delighted to work with Beth to put this series on for you. And as Beth mentioned, this is our 101. So think of this as sort of an introduction, high level overview to whet your appetite for more work impacting policy change. And with that, I'll pass it back to Beth for the next section of the presentation.
Yeah, wonderful to work with you as well. So let's dive in. And as I said, this will be recorded, so no worries about catching everything. You'll be able to go back to it. And if you want the slides, feel free to reach out to us. So mapping the policy.
Beth,
yes.
one quick thing. We should encourage everybody to use the Q&A forum if you have questions. We don't have chat on this, so please use the Q&A forum.
Yes. All right, mapping the policy landscape. So first of all, I think one of the most important first steps once you have your policy problem and solution is to really look at what level of government are you going to target. So that could be state, federal, national, international. For example, sometimes that will be dictated by what your issue is. So if you're very interested in care for older adults, you're probably going to tend toward working with Medicare, which is a federal program. And so that's going to move you more into the national space. Not always true, but these are general guidelines. If you're interested in working with patients who are of less socioeconomic means, then or patients with disabilities, you're going to tend to work more with Medicaid, which is a joint federal and state program. And so you may work at the federal level and or at the state level. And then if you're particularly interested in social determinants of health or mental health services or other social services, a lot of that is determined at the county level. Obviously, there are still decisions that are made at the larger level, but that can be really important to first just think about what level are you going to be working at. And sometimes you'll see that there's actually more than one level where you could work. And if that's the case, I really encourage people to think about who's in that role and might they agree with you. And we're going to delve into that a little bit more. I always give an example of a friend of mine who's a neurology resident at Stanford, Nuriel Mogavam, and he had seen at the bedside really that some of his patients who used marijuana were not able to get transplants, even though medical marijuana was approved. And so he first initially thought he would have to work at the federal level because of the transplant organization UNOS is sort of at the federal level. And he found out that they actually did not have any particular restriction at the federal level. And so then he was able to see actually that the issue was at the California level. And when he determined that, the politics actually became much more favorable. And it's one of the few examples I have of someone who saw something at the bedside and statewide policy was changed within less than a year, and quite an amazing example. So sometimes you'll find those windows of opportunity, and a lot of it has to do with the politics of the particular level of government that you're working with. So thinking about some key decision makers, I first always just liked people to start with who are your elected officials. And there are many ways to find that. You can start by just Googling who are my elected officials, and you'll find many different resources for that. The one I shared here, I like because it goes all the way from the federal level to like your most local representative in a very small neighborhood in San Francisco and everything in between. And so I like that one, but there's many and there's no right one. Usually you'll just put in your address and figure it out. And I always find that to be a good place to start because they are responsive to you. They are supposed to be responsive to you. And it's much easier to get meetings oftentimes with them or their staff rather than, for example, trying to get the key committee chair. You may want that too at some point, but it's always helpful to at least start with someone. And then oftentimes, once you've built a relationship with your local elected officials, they can help connect you with that committee chair or that leadership member who you're trying to connect with. And then next, I go to really looking at who serves on and chairs key committees. And there are, depending on what body you're working with, they will all have this on their websites. This is just one example here of the California State Assembly. And looking at, for a couple of reasons. One is if your issue is going to go through a budget committee or an appropriations committee, that'll have control over funding. Assemblymember Ting, who's pictured there, has been a chair of the budget committee in the state assembly. And so you'll see that that's really, if you're going with a budget item, sometimes depending on where you're at in the process, you really only want to target those budget committee members. And so I did one example was with our residents. Song Brown is a program that funds primary care residency programs. And at a particular time, Governor Newsom had proposed cutting that funding. And so our residents and all their sort of friends at other residency programs across the state came to me for advice on this. And the advice was pretty simple. It really had to do with timing, which we'll talk about in a moment. And then who's on the budget committee, and don't waste your time calling a bunch of other people. Really delve into who's on the budget committee based on where we were at. And that issue, despite being a quote unquote small ticket item, was the #1 called about issue in the state, and no surprise that the funding was restored in the final budget. So really important to see who's on those committees, and also important to then know how substantive their expertise is going to be in that area. So whoever chairs the health committee is going to have a much deeper experience and knowledge around health, for example. Then also looking at who serves in leadership roles. Of course, Nancy Pelosi here was speaker for quite a long time. She's no longer in that role, but those are really powerful roles. They can also be harder sometimes then to get a meeting if your local elected official is in a really powerful role. And then think about, do you have contacts with those people? And if you're trying to target a particular member, so helpful to be part of a broader coalition or professional society, or to have colleagues that are in the area where you're trying to influence someone. So then as you're thinking about reaching out to a policymaker, I always like to try to do a little bit of background for them in advance. This can be, if you already have a meeting and you're walking in, you want to try to learn what their perspective is, or it can be even before that point where you're trying to decide who to meet with. And so I use a combination. Quite frankly, I do use Google and Wikipedia, but that's not the only thing I use. I also use their own website, and I actually like to compare and contrast them, because if you look at their website, you're going to see how they want to present themselves to the world. So what their key issues are, what they want you to know about their background, what they're proud of. Of course, there may be controversies that they are not going to put on their own website. And that's why then I like to go and look at, I actually use Google News a fair amount, so that then you can actually look and see what's been written about them in the paper. And that's where you'll often find some more of the controversies. And then looking at what district do they represent. So that you can usually find on their website, just to get a sense of things. How long they've been in the position will give you a sense sometimes of how influential they are, or at the least, how well they know the process, and how well to navigate the political process. And then I really like to look at what jobs or positions they had prior to this. So, for example, Senator Richard Pan, who was recently the senator who was in charge of the health committee, he was a chair of the health committee. He was a pediatrician for a long time. And so you're going to approach him differently than someone who doesn't have a medical background. Senator Eggman, who is now chairing the health committee, she has a background as a therapist and a social worker, and you're going to approach her differently than someone who doesn't have a background in those areas. And then looking at what committees do they serve on, or do they have any leadership positions? So Senator Wiener has been the chair of the housing committee. So if you're going to approach him about housing, you're going to know that he has a much deeper expertise in that area. He's also our San Francisco senator at the moment. And then sometimes when you're running into roadblocks and you don't really know what is going on, I do like to search who their donors are, and that is all publicly available on the Secretary of State's website, which is there. And then next, looking at, have they sponsored legislation in the past 2 years related to your issue? That will give you a sense of where they're coming from, what their perspective is, and we'll delve in next to how to actually figure that out. But if they have authored or sponsored key legislation that they're really proud of, it might be on their website, and that will give you a hint that it's important to them. It's also helpful because you can then, as you head into the meeting with an ask, you can start by thanking them for their work. And I think all of us like to be appreciated before we're asked for something, particularly if we've worked hard in an issue or we're already aligned in general with someone. So next, this is going to be an example at the state level, and then we'll look at federal and local as well. But I want everyone to be aware of these resources. This is what the insiders use. This is what people who work in the Capitol use. This is what people who are lobbyists or paid, professionals use. Once there's actually a bill that's been introduced. It's less helpful if you don't have a bill that's already been introduced, if you're more in the sort of brainstorming phase, and we'll talk about when to do that in a moment. But once you're actually going to advocate on a concrete item of legislation and you have a bill number, this is really good. It can also be used for a keyword search, as you can see there. I will forewarn you that the keyword search is not perfect. It's really specific language. So for example, an issue I've been active on is safe consumption sites, which are also known as overdose prevention sites or safe injection sites. And so with the keywords, if you search one of them, it's only going to show up if that's actually what's in the bill text. And so it's not a perfect keyword search. I usually supplement it with looking at, Google News or something like that, or your local paper, and sort of, looking at, for example, the Chronicle's website, and then going into the search function to get a sense of what's happening legislatively. And then, of course, as you build your contacts, asking your sort of more insider contacts as well. And if you have a expertise or experience in a particular area, you're going to start to know this over time too. But once you have a bill number, or even if you're trying a keyword search, you can just go ahead and put it in there. The website's at the top. You see the screen, you'll see there. And what you get is the full text, which I don't really recommend using all that much unless you are really expert in something. I will say in California, it's a lot more approachable. It's less legalese than at the federal level. And it's probably even better at the local level. But what I like to use the most is the bill analyses. So bill analyses, when I worked in the assembly, this is like the sort of thing that we would write. And basically what it is a plain language summary of what the bill does, and then background on it, and then what the supporters are arguing and what the opponents are arguing. And then at the bottom, there will be a list of all the supporters and all the opponents. And so that's also a really helpful thing to, if you're thinking about new ideas, to be able, and building your coalition, to be able to go in and see like who has supported similar things in the past, or who are the opponents if you're going into meetings, to be able to actually see like, here's the arguments in opposition that I want to be prepared for being able to answer questions about that. And then also really helpful, you can see where the bill is at in the legislative process and how people have voted on it. So if you're going to meet with a policymaker to talk to them about an issue, if they've already taken a vote, you want to know. If they haven't voted, then of course you may not know what their position is, and that's part of what you're trying to find out. But you don't want to go in and ask for someone to support something that they've already voted to support without at least being aware of that. Okay, and then the same thing is available at the federal level. There are actually two that I recommend using. Congress.gov is probably the most official one, but it's a little bit more cumbersome to use. GovTrack.us is has a better search function. It also has a better prognosis feature, because at the federal level, so much legislation goes absolutely nowhere. Most legislation that's introduced federally has no chance of going anywhere. And so I really recommend using this as a sense of what the prognosis is. Most things that happen at the federal level are now, because it's so hard to get anything through Congress, are going through these big omnibus packages of legislation that the leadership is very involved in. But also gives some nice summaries. You can sign up for alerts, which is cool. And govtrack.us is quite official. It's actually something that the government, as you can tell, has put together as a resource for people to try to make these things more accessible. The same thing is available in San Francisco with the Board of Supervisors. The website is there. It's not quite as good, but it's still a really good resource. I will forewarn you that I think sometimes they're a little bit slower to update things. I think there's just less staffing at the local level. So, but on the positive side, when I have really wanted to know how a vote went and they haven't updated it yet, I actually call the number that they have on the website and a real human being answers and is extremely helpful. And so I highly recommend doing that if you need. And you can basically see where is it at in the process. You can see the actual language. Unfortunately, they don't have the analyses in the same way. You can also see all the different testimony that's been submitted, which is really nice, including your own if you choose to submit some. All right, and then I also, just to take a step back for a moment, I think it's also really helpful as you're approaching a new issue. Sometimes you are the expert in it. Absolutely, many people in this room are the expert. But that doesn't mean you always know kind of everything that's happened from different policy proposals over the last several years. And so for that, I find it really helpful to go to different policy institutes or think tanks and different reports to actually get up to speed on a new issue if you have not been as involved. And you may well be the expert when it comes to the research around an issue, but you may not actually know what's been happening in the policy landscape if you're newer to this. Or you may be a clinician who knows a lot about what you're seeing on the ground, but you don't really know in what ways have policymakers tried to solve this problem that you're seeing, if at all. And so there are several that I use. Here's just a smattering of them. The California Healthcare Foundation for anything healthcare and somewhat anything health related in California is a fantastic resource. I know many of us use that, and probably some folks here have contributed to some of their reports. In California, sometimes we're not looking directly at healthcare, but we're looking more broadly at social determinants of health or other policy areas. And for that, I think in California, I find the California Endowment and the Public Policy Institute of California, PPIC, to be really helpful in terms of reports. PPIC also has a lot of polling. And so if you're trying to get a sense of what some of the politics are around an issue, that can be helpful too. At a national level, the Kaiser Family Foundation, we have really deep ties with them and they do phenomenal work. At the national level, really focus primarily on healthcare, a little bit around social determinants of health. They have great slides, great graphics, great original research, and also great compilation of other folks' research. They also do polling more at the federal level. The Guttmacher Institute for Reproductive Health, the Commonwealth Fund is more comparative across different countries and their healthcare systems. And then there are tons of DC-based think tanks that don't have a specific focus on health, but have some expertise in health. What I would just say is try to research their agenda first. Many of them do have political leanings. And so if you go to policymakers with, oh, such and such think tank said this, they're going to want, assume that you're coming with they'll interpret that in the lens of whatever the political bent of that think tank is. Okay, so next I want to talk a little bit about the process of stakeholder mapping, which is not just the policymakers themselves and where they might be on an issue, but all the other stakeholders. So that might be professional societies like nurses groups or physicians groups or pharmacist groups. That might be hospitals, that might be community organizations, that might be different educational institutes, that could be, law enforcement, all kinds of insurers, there's so many different potential stakeholders. And you want to try to get a sense of where that landscape is. And answer really the question, does the group support you or not? And how powerful is the group? And I would say also that power can be two different things. So first, how powerful is the group overall, but also how much do they care about your issue? So for example, like the American Medical Association is very powerful, but if they have, even if they have a position of support on your issue, if it's not among their top priorities, that doesn't necessarily mean that they're going to have a lot of power on your issue. Versus a smaller organization, if they really care and they're putting all of their, power, whatever power they have behind it, they can also be really powerful on that particular issue. And then, of course, asking yourself, like, could you neutralize the opposition or could you gain support? And part of this is just an example from the state level, but to harken back to Leg Info, if you click on the bill analyses, this is what I was mentioning, you can actually see all the registered support and all the registered opposition. This is an example from SB 57, I believe, which was to legalize safe consumption sites in San Francisco, Oakland, and LA. And so this is just a partial list of the support and the opposition. And even if that bill is dead right now, then, if you are thinking about similar issues, this may give you a sense of who are some of the groups that have tended to be in support and opposition. All right, so we'll talk briefly about the legislative process. And this is, as I mentioned, an example from California. We'll talk about the federal process, which is much more of a mess right now. It used to be the opposite, but now California is much more of a defined process compared to the federal level. And whatever locality you're in, you can figure this out. It's different in every state. But in general, bill is introduced, tends to go to committee hearings, and then it goes to the floor. If it is going to cost money, it has to go to either an appropriations committee or a budget committee. Janet will talk more about the budget process. And then it has to go to the other house. So if it started in the assembly, it has to go to the Senate and vice versa. And if there are changes made, then after it gets through the second house, it has to actually go back to the original house for what's called concurrence and amendments. Then if it passes all of that, it will go to the governor, who will then either veto it or sign it. And most bills, unless there's an urgency clause, which requires a 2/3 majority, will not take effect until January of the following year. That screenshot there is of SB 57 on overdose prevention programs. And where it was at in the process. This is kind of the end. You can see that it went all the way through the Senate, through the Assembly, and then was vetoed by the governor. And so if you have trouble ever interpreting that, we are happy to be a resource for that. The language is a little bit unusual, but I think most of the time you can figure out what it's saying, and it will actually tell you the votes too. So here's the calendar for the legislative cycle in California. I find this to be incredibly helpful and important. So it is a 2-year cycle. So in January, the legislature convenes, and then new bills are introduced. If it's the second year of the cycle, there may be old bills from the following year that are still active. And then legislation starts to go through the different policy committees in February, March, April, May. There's a deadline to have bills get out of their initial policy committee in May, and to then get through appropriations shortly thereafter. Then from mid-May and through the end of June is really crunch time for the budget. So the May revise is after we have all the taxes, the governor puts forward their proposal for the budget, and then both houses of the legislature have to negotiate around that. It used to be that the budget would tend to go really long into the summer past the official deadline, but there was a ballot initiative that did a couple things. First of all, it said legislators would not get paid if they didn't pass the budget on time. And then it also took away some of the 2/3 majority. And so now Democrats can pass a budget without Republicans being involved or supportive. And so now, actually, in California, a budget does usually pass on time, sometimes with some straggling trailer bills afterwards. And then oftentimes people go back to their districts for a couple weeks in July after that, and then come back for another crunch time in August through perhaps middle of September. We're actually in the last couple of days of session. This Friday, the legislative session will wrap up. And so those are also crunch time where people are working long hours. And then the governor basically has September to consider whether to sign or to veto things. And then in the fall, people are usually back in their districts most of the time, sometimes campaigning if it's a campaign year, or not, if not. So the bottom line, if you're going with a new idea, fall is the best time to go for a new idea. If you come with a brand new idea in May or in August, nobody is going to do anything with that. It's going to go on a shelf. If you're going to talk about a specific issue, really helpful to go during the actual legislative cycle and to know where your bill is at in that process. At the federal level, it is much more of the Wild West. And so there is really no equivalent to Sacramento's calendar. The Congress meets year round, with its longest recesses are for the month of August and over the December holidays, but even that doesn't always happen. There's really no set timeline or deadline for bills to be passed out of committee. I really wanted to make sure and check myself on this. So I actually reached out to a longtime Washington staffer and advocate, and she said basically no deadlines, no set calendar for passing bills, no schedule for holding hearings, anything. And committees only need to give 48 hours notice prior to a hearing or a markup. Same with floor votes. So really, there is not a set timeline at the federal level. Anything that used to exist has mostly been thrown out the window. So really just tracking your issue and figuring out what timing makes sense for your issue, rather than looking at a particular calendar. And with that, just a reminder to put your questions, if you have any, in the Q&A, and I'm going to hand it over to Janet. And Janet, I will go off video, but I'm happy to advance the slides for you. So just
All right.
and I'll go ahead.
Great. Thanks so much, Beth. So I think we'll go to the next slide and shift gears a little bit to talk about administrative and judicial processes. I think sometimes we tend to think that the legislative action is the only action that's important, but it's not. Once the legislation is enacted, the action really shifts to the executive branch, which must implement laws. And sometimes the executive branch will issue regulations to implement the law. You know, sometimes the legislation will explicitly charge the agency with implementing regulations. Other times, because of the complexity, the agency will go ahead and issue regulations about to implement the law. And in California, the development of all regulations is governed by the California Administrative Procedures Act. That's a statute. And there are two processes for rulemaking in California: regular rulemaking and emergency rulemaking. And whether rulemaking or emergency rulemaking is used depends both on what the legislation says and the urgency of the topic. And so depending on that, some things, will be moved along quicker than others. Next slide. And here is a diagram of the regular rulemaking process in California. So as we see at the top left, starts with the legislature passing legislation, delegating the authority to adopt regulations to the state agency. Then there's some preliminary activities, then publication and issuance of a notice that the agency is going to open a rulemaking record, engage in rulemaking, and a 45-day public comment period on the proposed rules, opportunity to comment, consideration by the agency of how are they going to make major changes or minor changes. And so really that it's a process, it's a long process, but this really can be an important place for you to engage and contribute your expertise to the policy process, to look and see if those regulations are going to implement the law and as intended and achieve the desired results. Next slide. And so how do you track regulations? Well, here in California, the Office of Administrative Law, which is the state agency overseeing regulatory processes, has a website that you can search to find out where, which sorts of regulation, what's proposed actions on regulations have been posted, as well as final notices. So here, the example I pulled was a notice of proposed action on regulations for the California Student Aid Commission regarding completion of financial aid forms. And you can find many other regulations as well. Next slide. And here is a diagram of the federal rulemaking process, pretty similar to the state process. Probably the biggest exception is the standard comment period for the federal government is 30 days, whereas it's 45 days here in California. But again, this is important to pay attention and think about what you could contribute. We did a session last year on how to comment on draft regulations with one of the faculty at the Tobacco Center. Next slide. And so regulations.gov is a website you can go to search federal regulations. So if you're interested in a federal program, such as the Medicare program, this is where you would go to look up regulations and their status. And so the example here I pulled is some Medicare regulations for contract year 2023 regarding Medicare Advantage and the Medicare prescription drug benefits program. So you could go here to read the proposed regulations. And also, if you notice, there's a button down at the bottom called Browse Posted Comments. And so this is a nice feature at the federal level in the sense that you can see what others have commented. So both who's commented, who thinks this is important enough to comment, and also what have they said. So really, I think that's very helpful for sort of mapping the landscape and understanding the context. Next slide. And so now I want to turn to judicial processes. And if we, think back to the Affordable Care Act, certainly that, was congressional legislation, passed under challenging circumstances, but passed nonetheless, implemented initially by the Obama administration, but then also quite a long chain of litigation. In fact, litigation that in some ways continues to this day over the legality of the Affordable Care Act. And important here to know that the bottom line is opponents of laws and regulations can and do challenge them in court. Again, we've seen a lot of litigation now around the Dobbs decision. When you are thinking about judicial processes, litigation, important to really understand what level of law is at issue. Is it a state law or is it a federal law? Because that has bearing on whether the cases are going to be litigated in state court or federal court and where you want to search for information. So the Affordable Care Act was clearly a federal law. The Dobbs decision was in the Supreme Court because it had to do with prior Supreme Court decision under Roe versus Wade. But a lot of the subsequent litigation we're seeing play out in state courts because people are challenging state laws that restrict access to abortion. Next slide. And so how to track judicial opinions at the federal level? Well, the Supreme Court has a website and a section of that website where you can track their opinions. And so this is just the header for tracking opinions in 2021. If you went back today, you'd be able to look up 2022 and 2023 opinions. Next. And if you find an opinion that's of interest, you can get a PDF file of the opinion. Here I have the example of California versus Texas, which is one of the seminal cases about the Affordable Care Act. And so you could download this and read either the sort of preface summary at the beginning or a syllabus, I guess is what they call it, or the whole opinion. Next, please. And there are similar ways to track, there's similar ways to track state legislation, but in the interest of time, we won't go over that. Budget processes is what I want to talk about now, because again, and this is something budget engages primarily the legislature and the executive branch, although there are sometimes litigation around budget as well. But importantly, whereas legislative process starts in the legislature, budget process starts in the executive branch. And why is this important? Well, it's important because local, state, and federal governments develop budgets to allocate resources across all of the different types of services they provide. And important also to note that laws govern the extent to which elected officials have latitude to determine how resources are allocated. And this is particularly important at the federal level, but then has implications at the state level as well. So at the federal level, spending for some programs often referred to as entitlements, as mandatory, meaning you've got to follow the form, who's eligible for the program is based in statute, and those folks are entitled to the benefits associated with that program. And the federal government's obligated to spend the money on these programs. And as we'll see on the next slide, this has bearing on sort of where the action is, as it were, in Congress on budgets. Next slide. And so we see here, this is a slide. These are data that I pulled from the Congressional Budget Office's website and show federal government expenditures by type for fiscal year 2022. And so you'll see here 65%, that's almost 2/3 of federal expenditures are mandatory, meaning you really can't change what's being spent on what unless you enact legislation. 27% is discretionary. That's really where a lot of the fights are over how much is going to be spent on health, education, defense, within health. What types of things are we going to spend money on? You probably have read a little bit in the news about PEPFAR and Republicans in the House, some Republicans in the House wanting to stop funding that initiative, which is ironically championed by President Bush, but that's an example of discretionary spending. And then there's 8% that's net interest on our debt. Next slide. And so what this slide does, whereas the previous slide was, well, here are the big three chunks of mandatory, discretionary, and interest on the debt. This pulls it apart so you can see a little better what those programs are. So if you think about the 65% of the slice that's mandatory, that's Social Security, Medicare, the federal share of spending on Medicaid, other income security programs, so such as supplemental programs for folks who are on Medicaid, SSI, other mandatory programs. Then over here in the 27%, where we have discretionary, that's divided between 12% that's defense discretionary, so military spending, a little bit of health there on healthcare services for the military, but mostly not health. And then 15% is non-defense discretionary, which is health, education, transportation, commerce, you name it. And so you can see why some of these fights are so contested is that there's really relatively small slices of the pie that are being fought over, particularly in the non-defense discretionary space. Next slide. And so this is the federal budget calendar. And let's just say this is the ideal world. This is maybe the way it used to be when I worked in Congress in the 90s. It's not really quite the way things work now. Things now are a little bit more like the Wild Wide West. But the intention is that the president submits a budget proposal to Congress in February, and that usually still happens. Congress ideally adopts a budget resolution in the spring. Then the appropriation committees begin reporting bills. Late July, House and Senate finish consideration, and then bills are reconciled and sent to the president by October 1st, because that's when the new fiscal year begins. But as I've said, that's really not the way it works these days. We're facing another government shutdown October 1st, and we'll see what happens. Next slide. California, just as our legislative process is a little more predictable, our budget process is a little more predictable, largely for the reasons that Beth mentioned earlier, that budgets are developed in the fall by the Department of Finance and the governor and the state agencies. And at the same time, leaders of the state legislature are developing their budget priorities. So that's why fall is a good time if you have a policy proposal that relates to budget. That's why fall is a good time to start talking to people. Then the governor releases the proposed budget in January. Budget committee hearings are held February through April. And having sat through some of them go on and on into the night. But hey, we get it done. And then the May revision to the governor's budget comes out in May. And a lot of that revision has to do with revised estimates of state tax revenues, which have big, implications for what's really going to be available for the state to spend in the coming fiscal year. And so after the governor, pretty shortly after the governor releases the May revision, the Assembly and Senate finalize their versions, and the legislature passes the budget bill and trailer bills before the new fiscal year begins in July. And yes, Beth's absolutely right. There is some trailing trailer bills into July, but for the most part in recent years, we've pretty much hit the target of having the budget put to bed, if not in June, at least by July. And again, that's why Beth says, like, given this calendar, May, June, not a good time to bring up new ideas. Folks are working very hard to finalize the budget and are just not in a place where they're open to new ideas. Next slide. Put this slide on just to give you a sense of state expenditures and budget, kind of parallel to the federal government. Here, as you'll see, in this chart, which is adapted from State of California budget documents, 36.6% of our expenditures in the 2023-24 fiscal year are projected to be in health and human services. The bulk of that is the Medi-Cal program. The next up is K-12 education, and down in fourth place, higher ed, which is where our training missions here at UCSF would fall. Just a quick note here, this doesn't include federal funds allocated for health, human services, unemployment insurance, and other purposes. So Medi-Cal is a federal state program. Some of the funding comes from the state, some of it comes from the federal government. This is only counting the California state funds that flow into our Medi-Cal program. Next slide. So I think we got, not seeing any questions. But do put questions in if you have them. I think we can each maybe tell a little bit of a case study, our stories of impacting policy. So Beth, I'll pause and turn it over to you.
Great. Thanks so much, Janet. So we're each going to just share a story of our experience in impacting policy. We each come from a slightly different lens. I think Janet comes from a little bit more of the, as I call it, capital R researcher lens. I think I come from a little bit more of the clinician lens and education lens. And so I'll tell a story in that vein. So I'm going to talk about the work that I do with our residency program, and we do that in collaboration with Glide, which is a Tenderloin-based community organization. Glide both delivers a number of services, including harm reduction programs and meals 364 days a year and many other services. But they also do work in the policy and advocacy space in areas that make sense based on the programs and the clients that they serve. And so they're part of a number of statewide coalitions to do this work. So this past spring, we went to Sacramento in partnership with the End the Epidemics Coalition, which is a coalition that Glide and many other harm reduction providers are part of. And this has really been a 5-year process of us deepening this partnership. And it was so cool this past spring to be able to see the power of that. So we went to Sacramento to advocate for harm reduction funding in the state budget to really fund a number of things, but primarily the staff with lived experience that are needed at harm reduction programs. The request was $60 million in the state budget. It was actually to continue an ongoing program. And there was lots of evidence to show that these programs had been much more successful in terms of overdoses reversed, in terms of linkage to medication-assisted therapy, a number of different outcomes compared to some of the other proposals that were on the table. And so we went together, and because we went in May, when really the state budget was in its final phases, as we were talking about, we were really meeting with people who were on the budget committees, with key budget committee staff. And amazingly, we were successful. I will say definitely in the meetings, it didn't always feel like we were going to be successful. I will never say we were the only ones. We were part of a much broader coalition, and I think that's really important. If you're approaching things more from the clinical or education or advocacy lens, I'll let Janet tell her story sort of more from the researcher lens. But I do think from the type of policy impact work that I do, being part of a coalition is so important. So that you have people that are from different districts. And then when we would go in the room, we would be able to both have sort of the frontline harm reduction workers from Glide could share their stories of what they were seeing. And then our residents could also share some of the stories of what they were seeing when either their patients were successfully connecting or they were working in harm reduction programs. And then the reverse, when people were unfortunately not connecting and ending up in the hospital with overdoses or severe infections. And it was just really powerful to be able to see us be able to bring those multiple different perspectives, as well as the evidence and the credibility that comes with being a frontline clinician, and also collaborating with people who really generate the evidence for programs, researchers, et cetera. And so yeah, I'm proud to say we were successful. I will say we're not always successful. This year was a great marker of success, but certainly we were involved in safe consumption sites. We've been involved in a number of things. We went on 3 nutrition related bills, and 2 out of the 3 of them have moved forward. We're still waiting to hear from the governor, but so there are wins and losses, but going in coalition really helps to sustain you in that. And I will say, just on the budget process as well, if you go to the IHPS website and you look at our prior series, we have Scott Ogus from the Senate Budget Committee who really delves into the details of the budget process. And so you can look at that as well if that's something you want to get more involved in. And I'll turn it over to Janet. And reminder again to put things in the Q&A if you have questions.
Great. Thank you so much, Beth. And thanks also for the shout out for Scott Ogus's presentation. Yeah, I guess in some ways, Beth calls me a researcher with a capital R. And while that's true, I think what's also true of me is that if I've always been a very pragmatic researcher and very focused on what can I do that's really going to be helpful to policymakers. And one of the ways I do that is with my work through the California Health Benefits Review Program. And this is a program that has been around for about 20 years, authorized by the state legislature, under which faculty and staff at multiple UC campuses come together to analyze health insurance benefit mandate bills for the state legislature. So these are bills that would require health plans to cover particular services, particular providers, bills that affect cost sharing and other terms and conditions of coverage. And so we look at the medical evidence of medical effectiveness, impact on cost, utilization, broader public health impacts. Our team at UCSF really focuses on looking at evidence of medical effectiveness and figuring out, is there a scientific research base for thinking that this treatment is going to improve health outcomes? And so we do our analyses in 60 days, which for an academic feels like rapid. But the legislature always say, well, can't you do it any faster? We need it like tomorrow. But it's just been a wonderful, for me, it's just a wonderful experience. I was with some of my CHIBR colleagues yesterday, and it's just been really delightful to work with so many smart people, but also especially to know that our work is used. The folks who write the bill analyses routinely copy and paste information from our CHIBR reports. I mean, they give us credit, but they copy and paste. And so that's like, that they're reading it, and that their audience is reading that work and utilizing it to make decisions. We in CHIBR don't make recommendations. That's our choice to really be a neutral organization. I mean, hopefully, if we've done our job, we're pointing legislatures to conclusions, but we stay neutral. And I think that's part of one of the secrets to our longevity is we're regarded as a neutral entity. And, quite frankly, sometimes both the advocates and the health plans are unhappy with us. Sometimes they're both happy, and that kind of tells me we're doing our job. So my other work in health workforce, I'm not a frontline advocate. I do work with advocacy coalitions and kind of see my role there as the person who, provides, the facts, the evidence about workforce shortages, lack of ethnic diversity, the person who can maybe think about what are the big types of policy solutions. And that I know that my colleagues use that. I'm not the one who's out there on the front lines, but people are using the information I and my team produce to inform policymaking. So no right or wrong. Beth and I think represent two different ways of engaging in the policy process. And what's right for you may depend partially on your academic background and partially on where you really feel motivated to engage in the process. So I think I'll stop there and we have a few minutes. Does anybody have any questions? We'd really like to dialogue with you.
As we wait to see if anyone wants to add in any questions, I'll just let people know that as you leave today, there should be an evaluation form that pops up. We really appreciate that if you take the time to fill out that evaluation. And we really do use that. Most of the topics that are coming up for this fall and this spring have all been suggested from prior attendees. And so really welcome your thoughts, both about what was helpful in this talk, what could be better, but then also about what you'd like to see down the road. And if we can be helpful, if you have particular questions you want to ask us offline, or if we can be helpful in any way, don't hesitate to reach out. All right, I don't see any questions. Oh, wait, maybe one.
Okay, Rebecca Hargraves, let's see. Oh, but now Rebecca says, thank you. Well, thank you for attending, Rebecca.
Thanks so much to everyone for attending.
Yes.
Feel free to reach out to us at any point if you have questions.
Yes. Thank you very much, everybody.
Thank you.
Bye-bye.